Good afternoon and welcome to the webinar. Today our topic is ransomware and cybersecurity, two very important topics for your practice. I'm Cathy Bryant, Manager of Product Development and Consulting Services, and joining me today is Kassie Toerner.
Hi there, I'm Kassie Toerner and I'm a Senior Risk Management Representative in the Risk Management Department at TMLT.
Kassie and I have no commercial affiliations or interests to disclose related to this presentation. Also, we would just remind you, as always, that if you have questions regarding legal concerns of your practice, that we are not providing legal legal advice, and you would always want to seek an attorney's opinion. At the conclusion of today's presentation, you will be able to identify the potential threats and vulnerabilities to your network, including ransomware. You will also be able to assess the vulnerabilities within your practice and describe the actions to take to protect your network.
So as Cathy mentioned, it is important to identify and document the potential threats and vulnerabilities to your network, including ransomware, and we will discuss this in greater detail later in the presentation. Your data is very important. It's as precious as gold in many situations, your protected health information of your patients. And it is really critical that you know every person, every system, and application that creates, maintains, stores, receives, or transmits PHI or ePHI in your practice. Examples could be anything from a fax machine to your server backups, email, diagnostic testing, USBs. There are quite a few places where this data lives that you will want to identify. Many of you probably remember in 2003 when HIPAA went into effect, most of records were paper. Today we're in a very different environment with electronic health records, and there has been a bit of a change. It is easier to enter into an EHR versus breaking into an office to obtain protected health information. And who would have thought that we would already be living in the age of the Jetsons and having appointments via telephone or via computer. But this is a reality now where we find ourselves because technology has just moved so quickly. So it all comes down to risk and how you handle it and how confident you are in your efforts to protect your data and your assets. Accepting risk, reducing risk, transferring risk, avoiding risk. And your confidence level, again, in your efforts to protect your assets. So you're going to be hacked. What is your plan? The Assistant Director of Cyber Intelligence and Outreach at the FBI told attendees at the HIMSS conference in Washington, D.C., the mandatory transition from paper to electronic health records has been difficult from a privacy and security perspective. He noted there is a high payout in the black market for PHI because it is so detailed. He's encouraged healthcare to not only have disaster recovery plans in the event of a breach, but also to have a good working relationship with your law enforcement agencies. If you see something and you want to engage the FBI, act quickly. Even if they cannot recover the breach data, it's important to uncover the reasons for the breach. So identifying your assets and vulnerabilities, these are some questions that you can go through to identify and document where your PHI may be vulnerable. So where do you store your valuable information? Who may want to abuse this data, and how could they get it or steal it or compromise it in any way? Your ePHI. Cyber criminals, hackers, bad actors who are wanting to get your data, and then your vulnerabilities, known vulnerabilities, and zero-day attacks. So recently, there has been a shift in bad actors. Previously, in years past, cyber criminals wanted medical files to sell on the black market. There's been a shift from that to medical identity theft to other tactics like ransomware for immediate payoffs. And here is an example that we share from August of 2020. The FBI is confident that actors are using malware along with proxy servers to maintain a presence on the victim's network and further explore the network. Here, this slide breaks down the types of breaches of 500 or plus from January 2018 to December 2018 and compares it to January 2019 to September 2019. And you can see over the course of that year that hacking has gone up quite a bit versus the unauthorized access and disclosure of EPHI. We can also see the location of these breaches, that the email has significantly gone up in 2019 versus 2018, as has network servers, and actually the paper record breaches have actually decreased as a result.
So what are the vulnerabilities that exist in your practice? The Health and Human Services Office for Civil Rights has shared the top 5 cybersecurity concerns and trends that they see from those large breaches that Cassie was just sharing data on. The first of those concerns is ransomware. Ransomware is a form of malware that accesses your electronic data files and passes them through an encryption function, not necessarily a good encryption function, and then stores the resulting encrypted copies in their place. PHI or other sensitive data in your systems are now in the control of the cyber criminals, who then demand a ransom in exchange for giving you back access. The problem is that ransomware mutates and becomes more sophisticated as more advanced threats occur. TMLT had its first reported ransomware incident reported as a cyber claim in 2012. Back then, it was one of the very early cases that we were aware of, and that it took 4 years for the Office of Civil Rights to close that initial claim and investigation. Ransomware continues to be one of the most frequently reported cyber incidents to cyber insurance companies, and more than one claim has exceeded policy limits due to the massive amount of data that was involved. It's easy to see why ransomware is a threat to medical practices. As criminals no longer are interested in stealing data, they just want to make a fast buck in an untraceable Bitcoin payment. All they need is for one employee to engage with their malware, and they're in control. Your files are encrypted or locked. This is an example of a practice that came into work one Monday morning, and the first person in the office was unable to log into the network. As other employees came in, none of them were able to log in as well. The office manager tried everything she could think of to figure out why they could not get into their network. Ultimately, she called the IT provider that they used, who remotely logged into their server, and when he logged in, what he found was a ransom notice. Now, this is not the exact ransom notice, but it's an example, basically saying that the files are encrypted. In this particular case, this practice did not have an adequate backup, and so they actually uh, ended up having to pay the ransom in order to keep or to get their data back. So it's important that you and your staff know what to do if you get a ransom notice. You need to know how you can protect your network, and you need to know how to disconnect your devices from your network. In an article a few years ago, it was thought that it would not be long before a patient brings a private lawsuit against a healthcare institution for damages caused by the institution's negligent security practices. We have not actually seen this, but we have seen a trend in the last year or so where, with large breaches, we have seen several class action lawsuits. Here's another ransomware case. About 2:30 in the afternoon, a single employee got an ominous black screen with a ransom demand. Thinking it was just another annoying pop-up, she minimized the screen and kept on working. She was unaware of the consequences that her actions just had on the organization. A few hours later, their timekeeping system or database crashed, alerting IT that something was wrong. The IT systems administrator found an extension that was unusual on the infected computer. That single PC was disconnected from the network. In this particular case, this organization had a very sophisticated backup plan. They used a technology that streamed real-time data on its mission-critical servers to a contemporaneous backup. Lower priority servers were backed up only on a nightly basis. Once the source was isolated, the organization knew when the ransom occurred. They were able to go back to the last good stream data, and they literally saved thousands of files, time, and money by being able to go back and restore from their backup. So the huge lesson learned is you need to know how your backup system works. Can you restore from a backup? And has that backup restore been tested? We can tell you sad story after sad story where practices thought they had good backups, and unfortunately when they were needed, those backups had either not been set up correctly or they had been corrupted in some way and the data was no longer available. A more recent type of ransomware is called Maze ransomware. It only has been around for about a year. The goal is not only to encrypt your data, but it has also actually been stolen or copied outside of your system. With Maze, the ransomware authors or the cyber criminals threaten victims that if they do not pay the ransom, the information will be released on the internet. In most cases, by the time you get this notice, the information is actually already out on the dark web. So this is not to be considered an idle threat. It simply is an effort to get you to pay money. This is an actual message from a Maze ransomware attack. All your files, documents, photos, databases, and other important data are safely encrypted with reliable algorithms. You cannot access the files right now, but don't worry. You have a chance. It's easy to recover them with a few simple steps. And it goes through how you would actually go through and pay. My favorite part is the part near the bottom that says, We understand your stress and worry, so you have a free opportunity to test the service by instantly decrypting for free 3 files on your computer. If you have any problems, our friendly support team is always here to assist you with live chat. It's quite a business, this ransomware. So what can you do? Make real-time backups and store at least one copy offline. Have your IT deploy technology that prevents unapproved software from running. You need to restrict users' ability to install and run software applications. This would be the difference between a user access and an admin access. Keep your operating systems and all software up to date, and maintain your antivirus and anti-malware software up to date as well. You need to make sure that your staff know not to enable macros from email attachments. You need to develop policies and procedures on safe handling of email attachments, educate your employees, and report ransom attempts to cyber insurance, local police, and the FBI. And most of all, remember to have a data recovery plan and to test it at least annually.
So in addition to ransomware, another concern is phishing attacks. So how do cyber criminals get into your network through a phishing attack? Generally, it's a click on an email or a web link. And when this happens, there is a download of the malware. Generally, victims get infected with ransomware through the phishing attack that carries a malicious attachment or instructions for the recipient to click on a URL that downloads the malware to their computer. But victims can also get infected through maladvertising if they visit a site that is serving up compromised ads. And phishing practices generally show little resistance to ransomware viruses. How are these delivered? Typically, the majority of them are via email, and it is with the use of an Office document as the file type. So phishing, as we've been talking about, is a form of social engineering that uses email or malicious websites to solicit personal information from an individual or company, and they're acting as someone who is trustworthy, organization that you may know or an entity that you may be aware of. The goal of the phishing is to trick the recipient into taking the attacker's desired action, for example, providing login credentials or other sensitive information. You can see here 24% of physicians fail to identify phishing emails. And at least 80% of all malware attacks come from phishing attempts using social engineering techniques. So how do you identify phishing when it comes into your emails? Emails with a generic greeting could be a tip. Emails requesting personal information, emails requesting an urgent response, or emails with spoofed links. So here's a little sample that we have. Can you identify the warning signs from this email that is supposedly from PayPal, which says your account has been limited, which is trying to get you to urgently respond. Then it provides you some information to give your information and to log in, which is the trick to gather your data. And then they also offer here a little bit of reassurance, trying to convince you that this is the right thing to do. But again, this is an attempt or a tactic that is used to try to get you to get your information and share your information. So can you spot when you're being phished? Take the quiz here if you're interested in doing that. And here's another example, an email that is a spoof. If you look at this document and you were to hover over it, you would want to see that it goes to Google Drives. If your company does not use Google Drive, then you would hopefully recognize that that's probably not a reputable source, or if this email regarding a budget is not from someone within your organization that you know, that would be another tip to not open up this document. But you can hover over this and it will tell you where it's coming from. Another sample here, again, if you hover over the details that says to me, it will generate for you some additional information. And you can look at this. It's talking about a fax machine, but you can see that it's from a no reply, and eFax is not spelled correctly. And then again, if you were to hover, you would get on this fax, click here to view this file online. You would get another link, shows you a link that you can verify is not an eFax website. So again, another example here, if you hover over details, it will give you some information. Sorry about that. And then once you've done that and you hover over change password, you can see that this ML security would pop up again. That gives you the ability to verify that that is not appropriate and it's not an affiliated Google website, or a Google link rather. So the good news is there are some tips that you can do to hopefully prevent phishing, educate your employees. You can conduct phishing or vishing campaigns. Be suspicious of unsolicited phone calls, visits, or email messages. Do not provide personal information or information about your organization via these emails. Pay attention to the URL of the website. Some technical safeguards that could be implemented are antivirus software, firewalls, and email filters to reduce some of this traffic, and then also phishing awareness training to your staff. Next concern is remote desktop protocol vulnerabilities that we're going to take a look at. Remote desktop sessions are generally operating over an encrypted channel, preventing anyone from viewing your session by listening on the network. There is a vulnerability in the method used to encrypt sessions in earlier versions of the RDP. This can allow unauthorized access to your session using a man-in-the-middle attack. Remote desktop can be secured using SSL or TLS in Windows Vista, Windows 7, Windows Server 2003, 2008. While more secure than tools such as VPN, they do not encrypt the entire session. So with the remote desktop, it's a technology that allows a computer to connect remotely to a PC over the network. But again, these are still vulnerabilities that need to be monitored. The RDP ports prove hot commodities on the dark web. Remote desktop protocol access continues to thrive in the underground markets. Primarily, hackers who lack expertise to find exposed ports themselves. And this is the same technology that enables administrators to access remote machines and give hackers the keys that they need to break in, move around, or steal data from enterprise targets. And at the beginning of 2020, there was a Windows vulnerability that was put forth. Windows handled connection requests in the RDP server and client. There was a vulnerability there that a patch was generated. So you will want to make sure that you've added this patch to your Windows to remove that vulnerability. And that's the HHS cyber notice. So again, what can you do? Safeguards: close your RDP ports unless necessary for operations. Limit access to open RDP ports. Patch operating systems and devices. Have reputable IT professionals to maintain your network and hardware. And have reliable sources for information about alerts.
So the next cybersecurity concern is weak authentication. Do you use multi-factor authentication to log into your network? This is probably one of the simplest things that you can add that will add a tremendous amount of security. You're probably using it in many of your personal applications. Often bank remote or logins require two-factor authentication. Even things like Google or Gmail, those have the option of having two-factor authentication. And if this is something that you have not looked into, we would urge you to consider it. Because weak authentication is basically a result of single-factor authentication and poor password management. Even to reset your Microsoft account code, you have to get a dual-factor authentication or two-factor authentication. When it comes to login and passwords, you must have unique usernames, and you should have basic password protection protocols. This involves having a longer password. At least 8 characters is recommended. It should be complex, a series of uppercase, lowercase, numbers, and special characters. It should be changed frequently. You should have a written policy on passwords and your password protection protocol. The policy should include that passwords should not be written down, and it should also include what sanctions you will take against your workforce members if they violate the policy. For several years running, 123456 has been the most common password. Here we have a list of the worst passwords in 2020, and again 123456 is at the top of the list. You can see other very common passwords that are possible. With technology, you can set the requirements for password complexity and not allow employees to reuse the same password for a period of time.
Another concern is access controls, and this applies to your current as well as former workforce members. So access controls. Who has access to your systems? How do you grant, change, and discontinue access? What are the levels of access? As Cathy mentioned, it should be role-based, administrator, user, and these levels of access should be based upon what level of information is needed to complete that particular person's role. And then who audits current access privileges against who should have access within your system or systems. So access controls information system activity review, we would recommend that you periodically review your payroll report and compare it to your network and your EHR approved user list to ensure that there is not anyone on that list that is continuing to have access who should not have access. So the information system review, as we've mentioned, is a checklist. Periodically review it and make sure that you are monitoring that list so you're sure who is in your system.
The first thing that we want to make sure is that you know that you have to understand where you create, maintain, transmit, and store protected health information. It's not just your EHR. It may be in other kinds of reports that get downloaded to desktops. If you take photographs, you could have data on cameras, SD cards. Many organizations find that they have data in emails, unprotected Wi-Fi. One of the most common things that we find is, what is your protocol when you scan? Do you scan directly into your EHR, or do you scan to a local computer and then have to upload it? And how then is that data immediately disposed of or taken off of the desktop or the local computer? This is a common finding that we have with practices we work with. Here's an example of failing to implement the HIPAA security rule. This physician filed a breach report with the OCR to dispute over a dispute with a business associate. In the end, it was determined that he had not conducted a risk analysis at the time of the breach, and this particular issue led the OCR to say that all healthcare providers, large and small, need to take their HIPAA obligations seriously. Failure to implement basic HIPAA requirements such as an accurate and thorough risk analysis and risk management plan continues to be an unacceptable and disturbing trend in the healthcare industry. Here's another example from earlier this year. This one is a report of an impermissible disclosure of PHI. And again, the organization failed to conduct a risk analysis. They failed to have HIPAA written security policies and procedures, and they neglected to provide HIPAA training and security awareness training for their workforce members. Healthcare providers owe it to their patients to comply with the HIPAA rules when informed of potential HIPAA violations. Providers owe it to their patients to quickly address problems to safeguard the individual protected health information. And these are just a couple of examples of how the OCR, Office for Civil Rights, or the enforcement of HIPAA are really addressing the importance of HIPAA compliance for all sizes of organizations. You probably recall the news story back in 2010, I can't believe it's been 10 years ago, where a CBS News producer actually went out and bought a used copier to see what data was available on it. What he found is it had been previously leased to Affinity Health Plans, and that they had, by not erasing the hard drive or removing it when they returned their leased copier, they had an impermissible disclosure of PHI of over 300,000 individuals. They were fined a little over $1 million. This action was so important that the FTC actually came out with a copier data security, a guide for businesses. Now, over the last 10 years, I will tell you that copiers have become more secure, but if you're still using an older copier or a less sophisticated copier, you may have a significant vulnerability. Just like copiers, many pieces of medical equipment have hard drives, or may even be run by laptops as far as for testing go. So I would just encourage you to take a close look, especially anytime that you decommission equipment, to make sure that you are not dispose, or that you're not getting rid of a piece of equipment that has PHI on it. The basic rule of thumb that I tell people is if you enter patient information into a device and you can later reprint something from that device, it probably has some sort of memory or hard drive.
So as we've talked through these concerns about data and cybersecurity, you may be wondering, why are physicians a prime target for ransomware attacks? And typically, the bad actors that we've talked about know that physician practices are focused on providing patient care. You may not have an extensive IT resource. Practices may not have a plan to respond to ransom attacks or extortion. And physician practices often do not test employee readiness and response plans that are written maybe on paper but have not been tested. Here is a resource that is actually, it's a couple of years old, but it's a great resource that you can read and also share with your staff. It's just good information about not falling victim to ransomware attacks. Again, even though it's a couple of years old, it's still a very good resource that you can share with your staff and have them read about ransomware and destructive infecting computers, and it provides guidance on user prevention and mitigation.
So let's take a look at 4 very important network protections that you should consider for your networks. This information is from Tokio Marine, a large cyber insurance carrier. The first is two-factor authentication, which we've briefly mentioned. Having offline backups, spam filtering and email configuration, and next-generation antivirus behavior-based protection. Two-factor authentication is a simple and cost-effective security measure that links a login to a secondary PIN or token that's received on a different device, such as your cell phone. It adds another layer of protection to your password-protected access to your network. The majority of successful hacking and ransom attacks are the result of a hacker gaining access using a compromised login. Two-factor authentication can actually prevent this, because obviously the cybercriminal is not going to have access to your mobile device or other device that's needed for authentication. Using two-factor authentication, or you should use two-factor authentication on all remote access to email servers. Even Office 365 and G Suites have free two-factor authentications applications. And hackers can use compromised emails to launch ransom and social engineering attacks against your contacts if they gain access to your contacts. Offline backups offer another effective strategy to reduce ransom damages and business interruption. An online backup allows you to get the with an offline backup and you get infected, you will not need to pay the ransom because you'll be able to recreate your data from the backup. When appropriate, your IT provider will be able to wipe the virus, clean the devices and network, and reinstall everything from the clean backup. I would just give you a word of caution. If your IT guy says, we've got a great backup, we can wipe it and restore from backup, don't do that until you have gathered all the forensic data that you need, because we have case examples where practices have wiped their servers when infected with ransomware and subsequently had to report a breach because they were unable to determine if the data had actually been stolen or exfiltrated prior to the server being wiped clean. Hackers have been effectively attacking backups that are not properly protected. So connected backup solutions are vulnerable to malware hackers. That's why it's important to have an offsite backup. Spam filtering and email configurations. Your email server can automatically filter out suspicious emails. Activating these filters is one easy way to prevent dangerous phishing emails from landing. I will tell you though, despite aggressive filtering, phishing emails get through every day. To use filtering to quarantine suspicious emails and scan documents and files. Because cybercriminals are using a compromised account concurrently with the actual user, they may actually be able to hide their activity. That's if they have stolen an employee's email credentials. Check your email for suspicious email forwarding and mailbox rules. And these rules are a signature that reliably detect whether criminals have infiltrated your email. The last is next generation antivirus based protection. This is really a more sophisticated approach to protecting your network, because we know that traditional antivirus only is developed when there is a known virus signature. So these new antivirus behavioral-based protections actually scan devices for unusual behaviors and decide if a deviation is a threat. These solutions are typically connected to the cloud, so their ability to detect new malware variants is updated in real time. Sometimes this is called next generation antivirus. There are a number of companies that now have come out with these tools. There are only a few listed here, but if this is something that you are interested in, your IT provider can provide you many other options, perhaps, based on the size and the needs of your organization.
So it's really important to establish appropriate actions in the event of a breach or a ransom attack so that you are hopefully not caught off guard completely like this fella here and in a place of panic. Again, having a contingency plan in place, practicing it and reviewing it with your staff so that everyone is aware what that plan is and how it should be carried out. And here is a little cyber attack quick response sheet. That's maybe a little tip sheet that you can take a look at and use in your practice of how to respond, report a crime, report threat, assess the breach, and then determine is it a breach or is it not a breach. Again, developing a plan, you want to have a rapid response plan and you want to test the plan and the downtime procedures as well. You want to practice, as we've said, your downtime procedures. So developing a computer, quote unquote, crash cart, having copies that you would need to operate in the event that you could not access your EHR, if that's some type of SOAP note or something that's already on paper that you can make copies of. And then again, your clinic, practicing how they would function and communication of orders and how documentation of care would be handled. So generally, prevention is the most effective defense against ransomware. It's critical to take these precautions. Infections can be devastating to an individual or an organization. Recovery processes can be very difficult, oftentimes requiring a reputable data recovery specialist. However, if your prevention measures do fail, having your response plan in place typically would involve isolating the infected computer immediately. Infected systems should be removed from your network, turning off those devices that have not been completely corrupted. This may afford some time to clean and recover data, contain the damage, and prevent worsening conditions. Immediately secure your backup data or systems by taking them offline and ensure that those backups are free from any malware. You'll notify your IT. Most likely, you'll be working with them on these steps here that we've just mentioned. And then you want to notify your cyber insurance carrier and then notify law enforcement.
So in wrapping up, we're going to go through some cyber defense tips for smaller healthcare organizations. Many small to mid-sized practices believe that defending against cyber attacks is pointless, and they're just hoping that they're being saved by being obscure. I can tell you that we have worked with solo practitioners who have practices in small communities that think they are way off the beaten path, and they have had to report breaches. So here are 6 steps to improve your cybersecurity. Establish policies and procedures against opening emails and attachments from unknown sources. Use technologies that allow staff to open suspicious emails and attachments in a contained environment. Ensure operating systems and antivirus are updated and patched. Hire a cybersecurity firm to conduct vulnerability and penetration testing. Prohibit unauthorized access to patient data. Enforce passwords, auto log off, access control, and mobile device policies. And last, review your data recovery plan. And I would say not only review it, but also test it. Another good organizational or reference document for you is again provided by US CERT. They have information on handling email attachments as well as safeguarding your data that would be helpful to you as you go through your practice and determining how you can strengthen your defenses. You also may want to consider using basic encryption tools on all your hard drives. Make sure that if you do allow your patients to log into your network or your staff even for personal use, make sure you have a separate guest Wi-Fi separate from your corporate Wi-Fi. And again, consider two-factor authentication. Make sure you have a good backup plan in place and that at least one copy of your backup is maintained offline. Patch management is critically important. This on the right-hand side is some information that came out in August of 2020 about the FBI Cyber Division issuing a warning about organizations still using Windows 7, which has not been supported all year, well, for this year. And in fact, 71% of Windows devices in healthcare were still using Windows 7 in a survey last year. So make sure you're keeping your operating systems and software up to date with the latest patches. ensure your operating systems are patched with at least quarterly upgrades, and maintain up-to-date antivirus software.
As the complexity of connected technology used by healthcare providers increases, so will your cybersecurity risk. Providers may need assistance mitigating these cyber risks, including help with their IT systems, HIPAA privacy and security risk assessments, staff privacy training, and risk transfer or cyber insurance. And that is the conclusion of our webinar today. We thank you for attending. The slides and additional reference materials are available for download in the file pod that you have on the left hand of your screen. If you have any additional questions with regards to this information or cybersecurity and ransomware, please feel free to email them to consulting@tmlt.org. And again, we thank you for your time. Thank you so much.
Have a great afternoon.